Good morning, Hakan Agir. I'm very pleased to meet you finally in Istanbul, and thank you very much on behalf of all our patients. I would like to ask you some information about yourself and your experience. What kind of surgery do you prefer to do?
Okay, thanks very much. Thanks very much for coming and visiting me. It's my great pleasure to see someone from Ukraine. And of course, that will be my great honor to tell you about what we do here, what kind of surgeries we do here. I'm a plastic surgeon. I'm a pediatric plastic surgeon. I am a head and neck surgeon. I am an oncological surgeon. I'm a reconstructive surgeon. A lot of things I do, but mainly I do pediatric plastic surgery, which is cleft lip and cleft palate repair in the pediatric patients, which is very common in many countries in this geography. And also I do some other cases like the oncology cases, cancers of the skin, cancers of the mouth, tongue, and anywhere on the face. Not only I do the surgeries for these oncology, but I also do the reconstructions, which is sometimes very challenging and difficult. And I do microsurgery as well, which is very rare to see and to find in countries like Ukraine or some other countries like, the Kazakhstan or East Europe. So we do these surgeries here, I think very successfully, and I keep getting patients, a lot of patients in these fields.
I heard a lot about your successful experiences for the different patients, for instance, for the cleft surgery. Could you tell me, please, from which age this kind of surgery is indicated?
Okay, great. For the cleft lip and palate and many other congenital problems that, any birthmarks or any problems with the face, sometimes fingers, we prefer to do the first surgeries at the age of 3 months. For the lip repair, for the other ones, for the palate, it is 9 months to 12 months, but mostly I do it early to get much better speech results. I do the lip repairs 3 to 4 months, and we get good results aesthetically with the lip. These are the ages.
And is one surgery is enough, or we need to repeat the surgery?
Very good question. If there is cleft lip and palate, we do the lip, the first stage, and then we do the palate repair in the second stage. So there must be 2 surgeries before the child becomes 1 year of age. And then we do some other surgeries after the age of 6, like at 7 or 8 years of age, do some bone transplants, and do some aesthetic corrections maybe sometimes, and these are the operations later we do.
As you know, Ukraine has now a difficult military situation, and we have many people who has been blessed and have some facial burns. What kind of treatments can be proposed for such patients? For instance, do you do a skin transplantation?
Sure. Now, personally, I had 1.5 years of military experience. I was a military surgeon in the, the Middle East, so I know what it is like to be in the war. So I know the war injuries. There are different types of war injuries in the soldiers and the civilians. And most of them are the explosions or shelling injuries. Some of them are burns, as you say. For the burns, there are 2 stages of treatments. First stage is the acute treatment, is to clean the wound and make dressing changes and close it with the skin grafts. If the burns are very severe, which maybe sometimes, then you do the flap surgery, which is a bit complicated. You need really experienced plastic surgeons like myself. For the very severe ones, we do, reconstructive microsurgery, which is very rare, as I said before, to see in Ukraine, because I visited all the cities in Ukraine, and there's only Kyiv that we do these surgeries. Also for the civilians, they have these wounds in the limbs and the lower limbs, burns, but also some crush injuries due to explosions, mine injuries. These are very difficult injuries. And if you don't have a good plastic surgeon or plastic surgery techniques, unfortunately you amputate the legs and the limbs, which is very sad for these ones. So this is what I can do, which is what I can do for these patients in the acute settings. And then maybe during the time, I think there will be a lot of patients, a lot of soldiers and civilians, pediatric patients or other people with many wounds over the bodies that needs to be skin grafted or do some flap surgery to cover these wounds. So there will be a lot of work.
And normally it is also a many stages procedures, or we can normally do it with one surgery.
Under normal conditions, if you have some facilities, if you have the manpower and good surgeons, and then you can just do these surgeries one stage. But it depends, because these war injuries are more complicated. The patients stay in the hospital longer periods because they have many other injuries, like internal, organ injuries, some other injuries. With mostly second or third stage operation, maybe in 2 or 3 weeks of time, 1 month later, the patient gets well under normal conditions. But in the war conditions, this situation is a bit difficult because of the, the conditions.
Talking just for the reconstructive surgery for the war injuries, let's say in general, how long the patient should stay in the hospital and Istanbul if there is no other injuries?
It depends actually, but for the minor operations, the patient needs to stay in the hospital maybe 1 week, not more than 1 week or 10 days. And the maximum, I think, for the most complicated cases, I should say, with the microsurgery, we can discharge the patient 3 to 4 weeks later. And stay in the hospital 3-4 weeks, and then a week maybe follow up, and then they can go back to Ukraine or wherever they come from.
And if they have questions or something to you, would you be able to answer and to follow the patient when they come back home?
Exactly, that's what I do. For many years I visit Ukraine and some other countries like Romania, and I keep in touch with my patients. This is my policy and my basic principle, to be in touch with the patients, to be available for the patients all the time, not for the only war injuries, for all sort of reconstructive surgeries, for lip and palate surgeries, pediatric patients, and the aesthetic patients as well. We need to stay in touch. The plastic surgery operations, you need to follow your patients at least 1 year. So that's why I need to stay in touch. I go to Ukraine before the war. I was visiting Ukraine regularly, but if they come here and they get some treated, then that will be easy to follow them on the social media like WhatsApp or some other things online, communication. So we follow them.
And for the genetic deformation of low jaw, should we wait for which time to do a reconstruction? Should we wait until the jaw finishes to grow, or we can do it in the early age?
Okay. If a child has any jaw or facial deformity, of course, in the first few months, we need to review, evaluate the patient. And examine the patient, see some, investigations like MRI or some other thing, and then we make a plan. And most of the time, we don't touch the jaw bones or the other bones before the age of 6. Unless there is any indication, like if there is any problems with breathing and feeding, and if there is any problem with the speech, and then we do the surgery earlier.
Okay. And for the oncology treatment, what kind of surgery could you propose? What kind of technique do you use? Because here are the carotid arteries and it is like a delicate space.
Right. The head and neck is a different area, very difficult region, because there are very big vessels, big nerves, and the cancers, unfortunately, when they are advanced, when they are neglected by the patient, if they grow too big, they spread to these big vessels and the big nerves. But we still manage to do these operations, under these, conditions, because we have all the techniques, microsurgery, and this is a team approach. and we have the experience. I had all my experience and education for many years overseas, and so we did a lot of cases like this here, and we managed to remove many of the cancers that was reported to be inoperable, unresectable at Ukraine and Bulgaria or Romania, and we can do these cases here because these are advanced cases, so these needs advanced experience. We do these operations here, and it is not difficult if you're careful enough with the big vessels, with the nerves, and the patient survives well after the surgery.
Okay, it's very good news for our Ukrainian and not only Ukrainian patients.
Okay.
Thank you very much for
You're
the very
welcome.
interesting
You're
talk.
welcome. I hope you get all the answers.
Yeah, right.
Okay.
Thank you very much.
Great. Yeah, thanks. Okay, now this is a message from myself. Since the invasion or the aggression of the Russia to Ukraine, I keep telling this. Any patients from Ukraine, I will consult free of charge. Any patients, injured from the war, I will do my best. At this stage, I can't come to Ukraine as I was doing in the past because I helped many patients. But now, with my surgical colleagues, my friends from Ukraine, we keep in touch, and I give them my opinions, and we follow the cases sometimes together, some complicated cases. So I keep helping, and whoever wants to reach me, they can reach me on my social media and Instagram, and they can ask whatever they want free of charge, and I will do my best. Okay? Slava Ukraine!